My name is John Inderhaug. I'm an ED consultant and I'm the Director of Clinical Training for the Fraser Coast Hospitals. We are part of the WBHHS. I really enjoy living in Hervey Bay. The hospital itself is a perfect size. It's got enough activity that it provides its daily challenges at work, and also just living in this area and having children and raising kids here is probably the best thing. I actually started out training to be a physician, and then I discovered that the best part of my job was seeing the very sick people in ED, so I just moved over to working in ED. This was in Ireland. And then I came over here and I worked up in Townsville and Cairns before working my way down the coast. But I've actually done GP training as well, and I've worked as a rural generalist for a year in addition to this. But I've come back to ED because it's a discipline that, you know, I enjoy, I wouldn't say more, but I enjoy differently. And certainly it provides its daily challenges while I'm working here. I chose to pursue the pathway here because I find that you can do a lot more in a regional area than you ever can in the city. We work where we don't have subspecialities, a lot of subspecialities. We don't have ophthalmology on site, we don't have ENT on site. So when we have a patient coming in with for example, quinsy, we can't just call an ENT surgeon to help us manage that. We have to drain that ourselves in ED. And so you extend your skill set accordingly, and you do many things that you would never normally do in a metropolitan ED. And we do it well and we do it safely. Many people don't realise what they're missing out on when they stay in a big city. Although you work in a tertiary centre and you've got all the benefits of being in a city, you actually don't get to do as much as you would if you're working in a regional centre and you spend your whole time commuting. So if you take those two things out of it, I would ask, why would you not want to ever be in a regional place? I remember when I worked up in Mariba, down at Mossman Hospital, a wild boar ran out of the cane fields because we were burning the cane, and ran amok through the emergency department before it busted through a glass door and went back out. And that is the sort of things that happen when you work in a rural place. We haven't had that yet happen here in Hervey Bay, but I'm sure it'll cause a lot of interest when it does happen. That we see diseases and conditions which you just don't see in a metropolitan place. Around Maryborough we do have Q fever, we have rickettsial diseases, we even have melioidosis, which is only meant to happen up in the tropics. But you'll get to see all that stuff when you work here. It's not as frequent, but you'll still get to experience that. And it's just the daily challenges and the rewards from working in a regional centre. If you are considering to come up here to work, I would say definitely do it. Changing locations, if you grew up in a city and you want to come to a rural place, yes, it's a big change, but just know that you are making the right decision. You will have challenges here and rewards from your work which you will not get in the city. Definitely do it, and you're very welcome. You'll have a fantastic educational experience, you'll have a much greater exposure than anything you would expect before you come up here, and you're very welcome. We would love to have you here. I would never work in a city again after working here.